Good evening students, welcome back to our channel Ach'z. So today we had IELTS and OET exam. So this video is about the OET exam review or the question paper discussion from different centers. So we will let you know about the question papers available in different centers. 2 to 3 or 4 different set which we collected from different centers. So if you got any other question booklet means try to mention that clearly in the comment box along with the test center. Okay, then other students also can correlate or it will be helpful for others also. Okay, because different centers or different time zone the question papers will be different. Okay, so because whenever we release video some students now they will comment over that we didn't get these questions, so it is completely different. So rather than just mentioning like that, try to comment about the question in detail. Okay, so we will discuss about the reading module first. We collected 4 different set of question booklet. So the first question booklet in part A, it was COPD, chronic obstructive pulmonary disease. Test A including the causes and the risk factors. Test B about the symptoms and diagnosis. Test C about management and treatment. And the last test, Test D about the nursing intervention and patient education. In that particular set, the C1 and C2 including oxygen therapy guidelines and new advances in pharmacological treatment. So that's about the first set of question booklet. Coming towards the second booklet, and it's very happy to say that all the topic for WLRS section as we mentioned in our preparation guide. So if you watched our preparation guide means I hope you all attended well. So the topic, even though that is different in different centers, we just given the category which you need to concentrate for the day. So I hope you all attended well. So for the new subscribers or those who are here first time, we are releasing the preparation guide for each and every test day. In the monthly wise, we have 2 different test day now. So for that, we are releasing the preparation guide and the topic which you need to concentrate and all. So like that, you can make a complete preparation. Then it will be helpful in your real exam. And after the exam, we are making this review or the question paper discussion to let you know about the trend. So those who are planning for the OET exam in the upcoming months, this review video will help you know about the trend, current trend, what all are the area you need to focus and all. So we are continuing with the second set, that is Impactigo. In the test A, overview and the causes. Test B, including clinical features and diagnosis. Test C about the management and treatment, and the last test about the nursing role and infection control. In that, the C1 and C2 including hand hygiene notice, outbreak alert and staff training, antibiotic resistance and treatment challenges. So that's about the second set of reading. Now coming towards the third set of reading, again skin condition only, and in the preparation guide we clearly mentioned that the skin diseases are very popular in part A nowadays. Cardiovascular and the skin diseases they keep on asking this particular topic in part A, so try to concentrate on that. And we are releasing the materials in our Facebook page also. So today's topic, everything we will release in our Facebook page. Even though that is not same as in the real exam, you will get an idea about the topic, what all things you can expect in each and every test and how they can arrange the question and all. You will get an idea. So for the reading materials and for other resources also, you can just follow us in our Facebook page. The link is there in the description. Okay. And the topic, atopic dermatitis, eczema. In that, the test A including overview and the causes. Test B, signs and diagnosis. Test C, treatment and management. And test D about nursing role and patient education. In that, the C1 and C2 including staff notice, topical steroid application, psychological effect and advances in treatment. So that's about the third set. Now about the last set of reading, anaphylaxis. Test A including definition and overview. Test B about emergency protocols. Test C, treatment chart. And Test D, medication guidelines. In that, the C1 and C2 including hospital procedure memo and role of empathy in patient care. So that's about the 4 different set of question booklet for reading which we collected from different centers. It's from GCC, India, European countries and all. So if you got any other question booklet, means try to mention that in the comment box. So now we will move on with the listening module. In first set, part A, it was a talk by the cardiologist to the patient about the chest discomfort and fatigue. It's like the audio type is like a patient consultation. And part B, it was a talk between the nurse and medical team. They were discussing about the allergy management. The nurse is briefing on the allergy management. Part C, it was a interview portion about the disease awareness, different disease awareness. So that's about the first set. Coming towards the second set, part A, including the talk between the GP and the patient. It's like a clinical consultation again about shoulder pain post-injury. And part B, it's like the staff briefing about the morning staff is briefing on the discharges. It's like a talk between the nurse in charge and the team. And coming towards the part C, it's like a lecture about dementia care planning. Now coming towards the third set of listening, part A, it was a talk between the trainee doctor and the patient about the abdominal pain in a teenager. And part B, it's like a nurse shift planning, the talk between the nurse and the admin. And the part C, it's like a radio interview about the ambulatory surgery and the recovery. So that's about the three different set of listening. Now coming towards the third module, writing. As we mentioned in the preparation guide, so most of the centers, they got transfer letter and the referral letters. So we will discuss about the first set of letter, referral letter for dietary counseling in the obesity management only. So the scenario is like they given the patient name, 40-year-old patient with a BMI of 35 has been diagnosed with obesity related to hypertension. So you need to compose a referral letter to a dietitian for the dietary counseling and the weight management support. So that's about the first set of letter. Coming towards the second set of letter, it's like a transfer letter to the palliative care for end-stage renal disease. So the scenario is like the patient Thomas Lee, 75-year-old with the end-stage renal disease has decided to discontinue the dialysis. So your task is to draft a transfer letter to a palliative care team to provide the comfort-focused care. So that's about the second set of letter. It was a transfer letter. Now coming towards the next set of letter, again referral letter only, the post-operative wound infection management. I think recently also the students got this particular question. So the scenario is like the patient underwent an appendectomy 5 days ago, now present with redness, swelling and discharge at the incision site. So you need to write a referral letter to an infectious disease specialist for the assessment and management of a suspected post-operative wound infection. Now the next one, again referral letter only for this pressure ulcer. The patient is 80 years old, 80 years old, bedridden woman with stage 2 pressure ulcer. So you need to write a referral letter to the community wound care nurse. So the reason is like the regular dressing changes and you need to ask for the preventive strategies. Okay, and to the next one, again referral letter only, 65-year-old male with a terminal pancreatic cancer. So you need to write a referral letter to the palliative care team for the pain management and the home-based end of the life care. And to the last type of letter, referral letter, and the topic is chemical burn injury. I think it's a rare topic and some students, they just reported that they find difficulty to construct the letter and all. And they just given a lot of information. So they just find difficulty to concise the data and all. So 34-year-old male sustained burn to the face and hand in an industrial accident. So you need to write a letter about the condition to the burns unit. So the reason you need to include like the specialized burn care, including the fluid resuscitation and the infection prevention and the possibility skin grafting. So you need to mention about this total body surface area, TBSA, and the pain management measures used and all. So you need to include these all information in the letter. So that's about the 6 different set of letters which we collected from different centers. So I hope you all attended well. You can also comment over your experience. Now we will move on to the last set, that is speaking module. So coming towards the speaking section, in the first set of role play card, the setting is hospital. The patient is elderly patient, recently had a fall. So you need to explain the fall prevention measures, educate about the mobility aid and the safe environment, and you need to reassure and encourage the cooperation of the patient. So that's about the first set. Coming towards the second set, the setting is clinic, GP clinic. The parent worried about the child's high temperature. So you need to reassure and assess the symptoms and explain the home care and when to seek help or about the follow-up visit, and educate on the current dosing of the paracetamol or the ibuprofen. So that's about the second set. Coming towards the third set, the setting is home visit. The patient in pain during the dressing changes. So you need to acknowledge the pain and offer the reassurance to the patient, explain the steps and the importance of the procedure, and you need to offer the pain relief options, and also you need to suggest to consult the doctor if needed. Now coming towards the next set of role play card. The setting is emergency department. The patient is complaining of the stomach pain and the vomiting after eating out. So your task is to assess the symptoms, explain the needs for the fluid and possible test, and you need to advise on the food safety practices. And the next one about the setting is GP clinic. The parent is worried about child's ear pain and the fever. So you need to explain about the common signs and causes, educate on the medication and care at home, and discuss when to return to the hospital. Then coming towards the last role play card, the setting is school health clinic. Again, the rare card only. So the patient expressing concern about the weight and appearance. So your task is to provide the support and the listen actively to the patient, give healthy lifestyle tips, and encourage the speaking to a counselor if needed. So that's about the role play cards of today. And as I mentioned before, if you got any other question under WLRS means, try to mention that in the comment box. It will be helpful for other students also. And if you can give the details means, we can publish the material in the Facebook page also. So that's it about today's discussion section. I hope you all attended well, and if you have any queries or you need any particular video related to OET means, you can mention about that too. So do subscribe and watch on this page to get more OET related updates. So thank you so much for your time over here, and God bless you all.